Hi, my name is Dr. Brad Perez. I was born and raised here in Torrance, California, actually at Little Company of Mary down the street. I've been in practice now since 1994. So when you come to Back to Healthcare, we want to find out exactly what's causing the problem and not just treat your symptoms. We work with a certain power, innate intelligence that when we take pressure off nerves, those nerves are reconnected to the body and then your body can actually heal. That's what we're doing all day long here. It's not about just feeling good, but it's about function. That's the main thing that we do here. I'm going to tell you how Back to Healthcare actually started. Back when I was playing college football, I caught a football in midair and a linebacker hit me right up in the air and I flipped over and I landed on my back and I herniated 3 discs in my back. The disc went right into my spinal cord. I lost all feeling and sensation from my waist all the way down. At that moment in my life, I knew that I actually was going to have surgery and things were not going to be the same forever. We opted not to do surgery that night, and in the morning time I could move my toes. I did physical therapy for a little bit. I was able to get onto crutches, and then I met a doctor of chiropractic. Received my first chiropractic adjustment at his office, and right there I was able to throw my crutches away and actually move and walk and function normally. 3 weeks later after that, I was doing sprints, and then 3 months after that, I was released from care. An MRI said my discs were completely intact and they were fine. And I actually ran the Palos Verdes Marathon in a very good time, which was a hard marathon at that time. I was a pre-med student at the time playing football. I decided not to go the medicine route. I decided to go into the natural chiropractic way of treating, and Back to Healthcare started. My mom is also a physical therapist. We integrated right from the very beginning her physical therapy techniques with the new chiropractic techniques, and that was over 31 years ago. Today, we have very advanced chiropractic, physical therapy, personal training, regenerative medicine. It's very hard for us not to get somebody healthy and well again.
Hello, I'm Dr. Rockmore, and I'm one of the chiropractors here at Back to Healthcare. I've been practicing chiropractic now for going on 42 years, and blessed by God to still be doing so.
My name is Dr. Ishihara. I'm one of the chiropractors in this office. I've been practicing for about 8 years.
I graduated from chiropractic school in 2002. 2007, I joined the team at Back to Healthcare and started working with Dr. Brad.
Hey everybody, my name is Casey Warren. I'm one of the chiropractic assistants here at Back to Healthcare. I'm also one of the managers.
My name is Joanna, and I'm a front desk manager here at Back to Healthcare. I've been working at Back to Healthcare for about 10 years.
My name is Natalie, and my job position is chiropractic assistant.
I've been working here at Back to Healthcare for about 3 years.
My name is Josie. I'm one of the chiropractic assistants here. My role is a little bit of everything. I work both front desk and back desk.
So my name is Jackie, and I'm one of the chiropractic assistants here and one of the front desk as well.
Love working with Dr. Brad. We're like brothers. Love the other doctors we're working with, all the staff, they're just like family. And the patients come in and they join our family, so it's such a family atmosphere. That's why I love staying here.
Oh, it's very family-based and it's a very positive environment. I love working here because once I'm in, I become positive.
My experience overall here as a staff member at Back to Healthcare has been phenomenal. I love the people that I work with. I love the patients that I get to work with. And it was really no surprise that that was going to be the case. I've actually been a patient here for 12 years. And this place is like my second home, and this team is like my family.
It's been life-changing, not just holistically, but just overall. Being able to witness our patients go through their health journey, it's been encouraging.
I've seen people who are younger and older where they can either barely walk, and just to see the progression that they go through in their journey here, it's just awesome to see.
It's a place of healing, not just physically, but spiritually too. So
it definitely is a family environment. We're always learning something and we're always here for each other. We definitely look out for each other as well as our patients. So we're always tight-knit group.
We treat everyone like family, and as well as everyone is welcome, we make it so welcoming. So I think that's something that makes us different. I guess not everyone gets that experience of being treated like a family, you know, in a clinic or in an office.
Yeah, a lot of families connecting here, a lot of friendships being made even in the, with the patients.
My favorite patient would be the elderly. I understand them quite a bit as I'm getting older especially, but I also have an 87-year-old mom who needs care and keeping her going in her active lifestyle.
I have kids, so I do great with kids. You know, I love working with families. I love working with expecting mothers.
Working along with babies, you know, we see babies from once they're born up to, you know, they're elderly. So I love enjoying, you know, being with the kids and seeing them, you know, develop throughout the years.
You know, for example, when I was working on my son Brian, he had colic, which I only learned what colic was in school. And I actually did a chiropractic adjustment on his back when he was very, very small in diapers, and he basically stopped crying right away. And I didn't know what that was. And then I had to explore what really just happened. And he got better and well without any tranquilizers, which they were gonna give. They switched all the formulas up. I mean, he was crying nonstop for over a week. And one adjustment in his mid-back, it was kind of like a little toggle in his mid-back, like a Lego going into place. He stopped crying. So I specifically work with athletes that come in, from Olympic athletes, national athletes, to professional athletes, all the way down to your little leaguers. The reason I like working with athletes is I have their mentality, I know what they want to do, I know how they want to perform, and I get a very big kick out of watching an athlete just even perform a little bit better than they're doing the day before, or tremendously better.
I love working with athletes. I understand, I'm in tune with what their needs are, you know, when they have injuries and wanting to get back out there and perform at a high level. So I do great with athletes.
Are you an athlete? If you are, pay close attention right now. Strength, range of motion, reflexes, endurance, and power is all controlled by the nervous system. The nervous system starts in your brain, runs through your spinal cord to every muscle and tendon, ligament, and tissue of the body. And our job is to keep it free so you can have those elements of success of an athlete. So that's what good sports chiropractic does. It detects where interferences have taken place in the body, and we take it off so you can have the edge. And at Back to Healthcare, we definitely have the edge for you. Someone once said, an ounce of prevention is like a pound of cure. When we're dealing with the human body, we want to work on prevention. We don't want to wait till things break and then try to fix them. We're not tractors, we're humans. We have developed the Wellness Club at Back to Healthcare. A patient can come in once a week to once a month for a low price, and also use our gym and our trainers, physical therapy if needed. It is awesome. When you do come in, we have different levels of the Wellness Club, which we'll introduce you to. If you're into prevention and you want to go ahead and maintain your spine and nervous system throughout your lifetime, choose the Wellness Club. This is a new facet we're actually adding on to Back to Healthcare. Back in 2021, 2022, there was a lot of stress in my life. You know, I had everything from finances ripped out from underneath me to my mom actually passing away. What happened is it made me go into a certain condition where my heart started to race, and it's called atrial fibrillation. The doctors wanted to put me on medications forever. I did a procedure, it helped a little bit. However, they said that it was gonna get worse and worse, and 5-10 years I wouldn't be around anymore. What I did is I decided to do some really good research and figure out how cells regenerate in the body, especially ones that are dying. And I found out that you can do what's called stem cell therapy, and you could do PRP. So I found the best in the nation, and I got in an RV with my dog, and we traveled around and we visited all the major stem cell clinics in the nation and did the procedure. My heart rate was resting at 110 beats per minute. Today it's resting at 55 beats per minute at resting, but I blame it all on the regenerative medicine. So I got certified, I found the best technicians and nurses and hired them at our clinic, and we have integrated IV therapies, PRP, stem cell therapy, and it is making a big change in the way we do practice. Back to Healthcare is partnering with Torrance Regenerative Medicine to integrate this great practice. We have a medical doctor on staff, we have a nurse practitioner, and we also have a PA that is working with us that have plenty of years experience doing regenerative medicine. We also integrate them, and this is what makes us really amazing with our physical therapy protocols that we have in place for the past 31 years. So with that combination and the regenerative medicine, I don't see why patients aren't going to get better very, very quickly.